Hello, here you will see my journey as a hygienist from Florida to Europe. Maybe you can do the same. I entered the dental hygiene program at Tallahassee Community College in 1997. This is a snapshot of our morning huddle, something we did every day before clinic, and it helped us to prepare for our patients and to have a game plan for the entire clinic session. These are the lovely ladies from my clinic group. Here I'm getting some instrument sharpening done, probably for some sort of a competency, I'm not sure. But if you look behind me, my operatory is set up, everything is barrier wrapped, so it was probably something that I had to do before the patients arrived. This is a nice picture of me and Paula, one of our California girls. We had a good time together. This looks like an old-fashioned Ceph machine that I have not seen since school. Oh, dental materials lab. Yeah, this is us practicing taking impressions on each other. As you can see here, even in the 90s, our infection control was meticulous. This picture we took after all of us sat for the national boards, which we successfully got 100% pass on. Here I am with my family on graduation night. This is a local anesthesia course that I took in California, and I am the patient at this point, and then the next slide you'll see that I get my chance as well. So here is the crux of it all. This is when I visited Europe in 2000 to see a friend who I met in Florida when she visited the US, and I fell in love with Europe. If my memory serves me right, these two teachers both had worked in Switzerland in the 70s, I believe, and I do remember at least one of them putting pictures up during lecture of her time while she was in Switzerland. So after networking with TCC alumni, I was able to interview and find a job and start working in Switzerland. This office that I was working in was a perio office, and the other dentist was a specialist in endo. My first apartment was a studio apartment just maybe 100 meters away from the Rhine, so it was very nicely located. By 2005, I was working in another office in Baden. I really wanted to get to Zurich, but the market was saturated by that time. The next few slides are some of my early travels in Europe while I was there working. It was really nice to get around and be centrally located in the middle of Europe and have access to so many countries. So while back in the US, I sought out different avenues of hygiene, not just private practice, but teaching, which I thoroughly enjoyed. But the impression Europe had made on me was just too deep to ignore. So I made my way back over here, and I started traveling once again. Thank you for watching and listening to my international dental hygiene journey.